Hey there, are you an occupational therapy student and you are going for a fieldwork interview and you're kind of like, oh, I don't know what to do. I don't know what they're going to say. I don't know what they're going to ask. Well, my name is Huang with Hand Therapy Secrets, and I have done these interviews before. So I figured, let me share with you what your clinical instructor might really want. So I'm going to do this video because I have been notorious in the past for scaring the living shit out of my students. And I want to publicly apologize. I want to publicly apologize because I didn't really know I was doing that. Or maybe I did know and I was kind of taking way too much joy and fun in it. But anyway, those days are behind me. I really want to turn over a new leaf and be a better person and help you guys with any kind of interviews that you're doing. So I did share this other interview. It's like, what's the one thing that you shouldn't do, right? So that's for like if you graduated and you're going on and you're looking for a job, look at that one. Look for that video, basically. But if you're a student, the interview process is just a little different. So I'm going to share with you what I do when I get students that come into my clinic. So one of the things that I would do before I opened my own clinic and I would interview people, because I used to work in a hospital and I worked in a really busy outpatient setting, like a private outpatient center, and then now I have my own. But pretty much the main reason, no matter what setting it was in, was I wanted to know what my student was looking for, right? What are they looking for? What do they want out of it? What were they prepared to do? And then I also wanted to let them know what I had available to give. So one of the things that I was notoriously known to do was, like I said, scare the crap out of people. And it wasn't maliciously done. It really wasn't. It was to set expectations. So one of the biggest things about interviewing for a fieldwork position is just about setting expectations, right? So when I was in the hospital, I had certain hours. I had certain patient schedules and stuff like that, and what I was supposed to be doing. I sometimes would have to run to acute care and that kind of stuff. And so it was always explained to my student what was required of them. And then when I was in a really busy outpatient setting, which is like what most places are, I needed to let my students know that, hey, this is the kind of schedule that I have to keep because I have to be X amount productivity. This is like what my day looks like. And so this is what your day is going to look like. And it was bananas. And so there's a lot, it's very fast paced. And so I needed my student to know that. And then now in my own private practice, I also want to know what is, I also want to tell them what's expected of them, and then let them also decide, is this the experience that they're hoping for? Because really, if you don't want to do hands, like hands is a specialty within occupational therapy, and hands is a specialty even if you're a physical therapist too, right? So for anyone who's like really diving into and wants to become a hand therapist and wants to become a certified hand therapist, outpatient is a great setting for you. If you know that you don't want to do hands, then I need to know that because my setting might not be the place for you, right? So I have very high expectations, and not in terms of what you know, because you're coming in as a student so I can teach you. My expectation, like being high, is that I want to know that you want to learn from me. That's really the biggest thing. So when it comes to interviewing for a fieldwork placement, just know there's nothing to be worried about. There's nothing to be scared about. It's really just about letting the clinician, right, the fieldwork instructor, get to know you a little bit more, what you're like and what you're hoping for, and then what you also have to offer. And then they also get an opportunity to tell you what they're looking for, what they're hoping for, and the expectations of the clinic. Now, when it comes to taking students, like, we take students out of the graciousness of our heart. Like, honestly, there's no money, there's nothing, it's just really about giving back to the community. Now, some programs might provide CEUs and stuff like that, but I don't even know about those things because I rarely use it for CEUs. I prefer to take my CEU classes that I want based on the thing that I want to learn, right? So really the whole point of taking students is to give back to the community. You also get an extra hand while the student's there, but it's only an extra hand if you're really amazing, and I know you're going to be really amazing. So I really rarely ever had bad students, and it's because I outline everything that I want, everything I expect, and I make sure that it matches with me. So you as a student can do the same thing. Make sure it's what you want, because getting this particular experience is extremely important to help launch what you're going to be doing afterwards. So I like to take students that have an interest in hand therapy. I want somebody who has an interest in doing this after they graduate, because it is a specialty. So if you are an occupational therapist, and if you're an occupational therapist student and you have an interest in hand therapy, talk to your fieldwork coordinator and make sure you get a placement in a hand therapy clinic so you can really know what it's like and get you the skills that you need that's really going to propel your career after you are all done. If you like videos like this and you are interested in hand therapy, then hit subscribe to Hand Therapy Secrets, because I am here to provide more and more information, more videos to help you become the expert hand therapist that you're hoping to become.